their biggest reason for coming in is their wife is nudging them. Either they've got this elbow to the side, or they've been kicked out of the bedroom
There's a sleep
completely.
divorce, which I hear is the
And
the
sleep.
next big thing, huh?
It is, and so they're sleeping in separate bedrooms, and so men often, they don't really realize the connection with high blood pressure or cardiovascular issues or diabetes or cognitive issues, but the bed partner complaining of snoring and gasping, that really drives them. So, men are, and they too listen. They come in, they've tried the CPAP, they can't tolerate the masks or the pressure, so they end up in my office, and so I evaluate them for mandibular repositioning device that gets their jaw into an ideal position and allows them to keep their airway open so that the tongue doesn't fall back and occlude the airway. And then we have other modalities in our office. We use, in addition to myofunctional therapy and breathing re-education, we use laser therapy to help with tighten up the tissue in the back of the throat. It's a CO2 laser. Um, but men are really, and they often. I have this one patient that, um, they say, well, snoring doesn't bother me. I'm asleep. And so I just think that's just so funny. And sometimes they come in for treatment for mandibular devices, where they're going on a weekend with their buddies and their buddies don't want to hear them snoring. And so a lot of it has to do with snoring. And snoring is basically vibration of the soft palate. Okay. It's tissue that is floppy and it vibrates and that noise and there's different types of snoring, but the most common is palatal snoring. And so when you have a mandibular repositioning device, getting that jaw downward and forward, that often helps with the snoring, but not always. So you need to do myofunctional therapy and possibly laser treatment. Now, I find that combination really works. And sometimes I have husbands and wives come in. And so when both are treated, and of course, I try to stress the importance that when you're treating your apnea, which is a serious medical condition, I mean, it can be really fatal, then you're giving yourselves 10 extra years
Mm,
by getting treated. People don't realize that. Well, I thought I just snored. I thought it
mm,
was just snoring. Well, no, it is lack of oxygen. An apneic event is lack of oxygen for 10 seconds or more. 10 seconds or more, it could happen 15 times per hour, but that means, that's moderate sleep apnea, but you're not getting oxygen to your brain and your heart and it's all the systems that are affected by an apneic event. And so yeah, men are fun. They're fun to treat. They're often very honestly very easy to treat. Because they once they understand the sort of the architectural issues, then they understand that a happy wife is a happy life.
yes. So that saying is over across the pond as well. We don't just hear that
Right,
over here, huh? So
right.